go.
Okay,
Oh, there
I
you
take
go.
it off, okay?
We have somebody from Dallas who have sciatica and can't stand straight, and coming from Dallas to our place to have treatment, and you can stand.
Yeah, I do have a lot of name tag like that. I may have to make you a nice one, okay?
I was laying in my bed. I'm an HSE consultant working in Big Lake, Texas, and laying in my RV bed.
Yeah.
And I was doing exercises to get my stomach to go down.
Yeah.
And I was making my leg like this, but it was up in the air.
Yeah.
And I went too far this way, and I heard something go.
Oh, you heard a noise.
Yeah, I heard a noise, and so I didn't think nothing about it.
Yeah.
When I tried to get up the next morning, I was like this.
Oh.
And it took me. I was late for work that morning.
Yeah.
It took me an hour and a half to get ready to put my clothes on, because I'd have to sit down
Yeah.
and put my clothes on,
Yeah.
you know?
Yeah.
And after that, you know, my boss said, well, you were late. And I said, well, look at me. He said, well, you need to go to the doctor. So I went to a doctor in San Angelo, Texas,
Yeah.
a chiropractor.
Yeah.
Here I was thinking that he was going to crack my bones and make me better. They took x-rays. They says, nothing's wrong with your back. You just probably have a pulled muscle. We'll put you on some heat.
Yeah.
That was October the 10th or 11th, something like that. So the next day, I felt it was getting worse.
Worse.
So I met a guy at the service station. He said, man, you're bent over pretty bad. He said, you need to go see a chiropractor up in Midland, Texas.
Oh, Midland, that's far away from here.
So it was 80 miles from my job site where I was working at.
Yeah.
So I went up there, and he said, oh yeah, I can fix you, no problem. He said it'd take probably 3 or 4 treatments. I said, okay, not a big deal. So he cracked my back, like the other guy in San Angelo. That was on a Monday. I went on a Friday. He cracked my back. Well, he couldn't make the 3rd appointment. He had some family emergency.
Yeah.
So I went to another doctor. I don't remember the first doctor. Second doctor was Dr. Thomas. He's a nice fellow, personality-wise. Then I went to another doctor, Dr. Crane. He said, oh yeah, I can fix your acupuncture. I said, you're the man I need to see. So when he laid me on the table with just my underwear on and a gown, he brought up these 2 probes.
Is he an acupuncture doctor or a medical doctor?
He is. He had a big plaque from China, but he didn't use needles.
Yeah.
He used a probe. And he had, you know, 2 probes, and it would shock me.
Yeah.
You know, I didn't like that.
Yeah.
He said, well, you know, I got to do a PET imagery.
Oh.
And I said, well, what's that? He said, what it does, it takes a picture of your body, and if it's red, it shows pain, where your pain's at.
Yeah.
And he said, but you got to get naked. I said, naked? He said, yeah, and I have a guy in there. So I got naked, and they took their pictures, and they saw all the red here, all the way here, nowhere else on my body. He said, oh yeah, you're telling the truth. I said, do you think I'm going to spend a lot of money to come to you just to say hello to you when I don't know you?
It showed the red spot with the pain, is that right?
Yeah,
it
on
did.
the PET imagery, showed it right in here.
Yeah.
And he said, well, the doctor that reads these for me, he's a surgeon, so he'll probably want to cut on you. I said, nobody's cutting on me. I paid him and I left and I came home. And then I called my mother. I said, Mother, I'm in so much pain. She says, I know a guy that can fix you. And that's you.
Your mother?
My mother out there. She sent a lot of people to your clinic.
Yeah. So most likely that one who recommends surgery, it could be a medical doctor and using Western medicine to
I think, well,
surgery.
he's using Eastern medicine, you know, China medicine. I don't think he's qualified personally. Because he was using these probes. You know, a black probe and a red probe, and he would shock me. To me, that's not acupuncture. The only acupuncture I know is with needles.
Yes, that's...
I went to my family physician, and he gave me some pain medication. He gave me some spasm pills. And I asked, I said, why don't you just give me a TENS unit, write a script for a TENS unit? And he said, no, I can't do that. He said, you need to come back and you need to do physical therapy. I said, physical therapy? I said, I don't need to do physical. Just give me the TENS unit prescription, because you got to have one. And he said, no, we're going to treat it with medicine, physical therapy, and then we're going to do surgery.
Oh, surgery.
I said, you know what? You're my family physician. I like you a lot. And nobody's cutting on my back. Nobody will ever cut my back. If I have to stay in this state, see, I can feel it right now. It's traveling here to here. It's like a ping pong. It's back and forth right here.
Yeah.
And so I saw him last week.
Oh.
And I got the pills. But you know what? I took the pills, the muscle spasm pills, didn't even faze me. Didn't even hit it. Now I personally don't like to take pain pills because I feel that people get addicted and it's a crutch. I kind of like to do the normal, the natural thing. That's what I've done without so much. I took one pill and it knocked me out. So why do I want to do that? I have to work, I have to live, breathe, whatever. I can't take that type of pill. So I refuse to take, pain medication. So you're my last hope.
I hope I can help you.
But you have to have.
How much less pain?
I'd say reduced by 35%.
35%, and now it make it possible for you to stand straight.
Yes.
Yeah.
I couldn't stand up straight.
Yeah, but now.
Is your hurting go through your legs?
Hurting is like a spasm, like a little donut right there. But when I came in the door, it was that big, the pain. But now it's condensed down to about that.
Yeah.
Right there.
That one. Okay.
You can give him a quick needle.
But now you bending or no bending? You can bend, no problem.
Yeah, I can bend over.
Yeah, but he could not straight. He could not stand straight before.
Okay.
Just before the treatment, half an hour ago.
How much so you got?
Isn't he wonderful?
He's good. You know he's a Christian mother?
Well, I read that, and I did.
SMU, he's a Methodist.
Yeah.
He believes in God.
Oh, praise.
Yes, we are Methodist.
That's
We
very.
had 2 treatments already. He only had like 4 needles. This is my second time here. I was in pain for 4 weeks. He knows this because I told him yesterday. But I was in pain for 4 weeks. I went to 2 different chiropractors. I went to my family practitioner. They gave me medicine, spasm pills and stuff like that. And my mother said, hey, come see Dr. Ling. I was in here yesterday. It felt a whole lot better. And yesterday it went from
it's a muscle spasm, basically.
Yeah,
That's what I had. Yeah.
a muscle spasm that was the size of a grapefruit. And yesterday when I left here, it was condensed down to a tennis ball. When I came in this morning, it was condensed to a golf ball. Now it's not even there.
And I bet you couldn't walk, you had to walk a certain way.
Oh, well, whenever I was just laying in bed, and when I was in, I'm a HSE consultant for a big gas company out in Big Lake, Texas, laying in bed, and I thought, I'm going to get rid of my belly. You know how you do your exercises like this? I did the wrong thing. I went like this, hi-yow, and I knocked it out of place.
Never had that before, right?
And I never had that before, and I'm 56 years old. I have perfect health, no other than me being diabetic, but I take care of good diet, take pills and stuff like that. Never dreamed something like that. So I talked to a bunch of my friends. In Canada, a guy said it took him 9 months with a chiropractor.
And how did you find Dr.?
My mother. My mother. Yes, my mother had, she knew the prior owner to this, but he passed away. But she had real bad back problems. She had 90 needles in her back. 4 sessions and she was healed.
She came here?
She came here. 4 sessions from the other Chinese doctor that was here, and had 90 needles in her.
Oh.
And she had 4 sessions, but today, look here.
You mean that somebody went to another acupuncture in 90 needles?
90 needles, that's what my mother said. She was in here yesterday.
Yeah.
She had 4 sessions and she has no pain in her back.
Okay. Yeah. Came here for section. Your mother.
Yes, the one that was here yesterday going like this.
Yeah.
She was talking to everybody, bless her heart.
Yeah.
I need to pay you guys.
Yeah. And now you have no pain.
I have no pain.
Yeah. Yeah.
I have no pain.